So good morning, everyone. My name is Nicola McNevin. I'm Education Lead at JA Nova Scotia. We are very pleased to welcome you to our Healthcare World of Choices event this morning. Thank you, teachers and students, for joining us. Today is the third day in the series of World of Choices virtual events, and we are so pleased to welcome today's career mentors and Career Expo participants who have generously donated their time to be here today. What will this morning look like? Well, essentially, there are two parts to today's event. First, we will introduce you to 4 featured career mentors. Each mentor will share their education and career stories with you. Then there will be a career expo. You will visit the Career Expo either as a class or individually. Visiting a Career Expo booth will allow you to further explore some of the education programs offered and career options available within Nova Scotia. Before the Career Expo, we will go through the participant profiles together so that you can choose the booth that is most interesting and exciting to you. And we hope that you enjoy. I do have some introductions to go over before we begin. First of all, I'd like to thank RBC for sponsoring this event. And I would like to introduce our co-host, Anna Nagulik, who is in the RBC Olympian program. And I'm going to share Anna's profile with you in just a moment. Anna, do you want to say hi while I get that up?
Hi, yeah, I'm Anna Neglich. I'm with RBC. Nicola's gonna introduce a little bit of my bio athletically, but I'm working as RBC as an RBC Olympian. So I work in a virtual office setting with a flexible schedule to gain valuable career experience while I'm still training in my sport. I work with marketing and communications mostly and on different projects with RBC, but also a big part of what I do is being involved in these speaking engagements at RBC sponsored events to share some stories and talk about my personal experiences. But today I'm just here to co-host this awesome event.
Super. And can everybody see this bio about Anna? Is that working? I hope so. Great. So as Anna mentioned, she is in the RBC Olympian program. She is a sprint kayaker, which is so cool. And in the 2019 Pan American Games, she was gold medalist, Canada Games gold medalist, junior and 23 World Championships finalist. Previously an RBC Future Olympian, having earned funding through RBC Training Ground, Anna has been a kayaker for the past 12 years. She is a recent graduate of a BSc in kinesiology, which she completed while training full-time and mentoring other students. Anna is a very busy lady, so thanks, Anna, for taking the time to be here. Anna is also passionate about giving back to her community and paddling club, which is Mascot Aquatic Club, encouraging kids and teens to enjoy lifelong participation in sports by volunteering with Fast and Female and the Paddle All program. At the 2019 Pan American Games in the K4 500 meter event, her team won the first gold for Canada, fueling her Olympic dream even more. Anna, we are so happy to have you here. Thanks for joining.
Thank you for such a wonderful introduction.
And I have one more thing that I'd like to share on behalf of RBC. They would like to say a few words, a message about today's program, and wish everyone some well wishes for participating. And I'll get that link up. And what I'll ask is that everyone play that individually in their classroom, as the video does play better when it's shared through the chat than if I play it for you. So we'll just take a moment. And I'll put that in the chat for you. It's just a 1-minute video. And hopefully that will work okay. Okay, thank you everyone for taking that moment. Hopefully there was enough time there for everyone to watch the RBC welcome. I'd like to get rolling. Let's get started. I'm very excited to introduce our first career mentor this morning. I'd like to welcome Laurel McGinnis, orthopedic surgery physician assistant. Welcome, Laurel.
Thank you, Nicola and Anna, for having me and inviting me to this event today. And I'm happy to speak to you about my profession and how I arrived at becoming a Canadian certified physician assistant. So I thought I'd start with just a little bit of background on how I came to the profession, my education, and then I have a short PowerPoint that outlines what a physician assistant, or PA, as we like to call ourselves, what we actually do, what our role is, and then if you want to ask questions about that or how you can look into the program, I'm happy to answer those questions. So to get started, I am from Halifax. I went to JL Ilsley High School. And during that time, I knew that I was very interested in the human body. I love sports and biology. So I geared all of my courses towards potentially moving into a science degree. I applied to Mount Allison, and I was accepted to Mount Allison in biology degree. And during that first year, I actually decided to transition into human kinetics. So I transferred to St. FX for human kinetics, and I was lucky enough to pursue that degree, finish that degree. And I worked in a physio clinic for 2.5 years. And during that time, I also worked as an athletic trainer with several sport teams. So a few high school hockey teams, national football team, and then I went over to Austria to do a little bit of travel and worked with a professional team over there. During that time, I knew that I wanted to pursue something more, likely in medicine. I didn't know about the PA profession at the time, but I was lucky enough to run into one of our orthopedic surgeons in Halifax through the physio clinic I was working with. And he introduced me to the PA role. And at that time, this was over 10 years ago, he was looking at how he could help to advocate for PAs and bringing them into the maritime provinces. So after he told me about the profession, which I'm excited to tell you about today, I applied to one of the programs within Canada and went out to Toronto, and that's where I pursued my professional degree as a physician assistant. I've been working as a physician assistant now for approximately 7 years. I worked 3.5 years in Toronto in an emergency department. So sorry, it's been almost 6 years. And then over 2 years now in Halifax in orthopedic surgery. So Nicola, if you want to put the PowerPoint up, I'm happy to go through that now.
I will do. 1 second now. We'll get that. Hopefully we'll start on the first slide for you. Can you everyone see that?
So physician assistant role in Nova Scotia, and I want to talk to you particularly about the PA role coming to Nova Scotia. We're currently in a pilot project, meaning the role and the career is not permanent yet in Nova Scotia, but the great news is it's passed legislature through its first reading, meaning we are looking at bringing our career and the role here permanently. So if you are looking into the role and pursuing this degree eventually, we will be looking for more PAs in several different areas of medicine, and this is very exciting to us. Great. So what is a physician assistant or a PA? PAs are highly skilled healthcare professionals educated in a medical model who practice medicine. So the two types of degrees, you can either gain a bachelorette or a master's degree affiliated with one of 3 medical schools in Canada. And we practice medicine as a direct extension of our physician or surgeon. We can work in hospital settings, clinic settings, and we help to extend physician services. Yeah, so we can move on from there. I'm trying not to read directly off of the...
It's great, thank you.
So the PA training, we are trained in the same medical model as the physicians we work for, meaning if you're looking at a mid-level professional, such as a PA or a nurse practitioner, often NPs or nurse practitioners will have a nursing background. We begin with basically a science degree, and then we move into a professional degree such as, we move into basically something where there's a clinical setting, like a physiotherapy clinic. So we have a lot of people come from paramedicine, and then you move into the PA profession. So we really like to have some type of hands-on clinical experience before you become a PA. And the three programs that are offered in Canada are through University of Toronto, McMaster, and University of Manitoba. All three of these universities have accreditation, and the PA program is run through each of their faculty of medicine. The prerequisites, so they're a bit different for each of the three universities. The one I can speak to mainly is University of Toronto. So again, they prefer to have an undergraduate degree, 2 years of hands-on clinical experience, and then we look at GPA, mini MMIs, and the PowerPoint refers to something called a mini multiple interview, similar to medical school. If you're looking at an MD, you still go through the same interview process. And the program itself is 2 years, but it's 24 months consecutive didactic and clinical training. So didactic training means in your first year, you're sitting down, going through lectures. We have a lot of the MD pre-recorded lectures, and then all the similar textbooks that the medical students would be reading. We're going through the same kind of curriculum. And then in your second year, you have 12 months of medical rotations. So when you think of a resident, I don't know if you've watched any of the medical TV shows, but if you think of a resident who goes through each of their rotations in family medicine or internal medicine or general surgery, we have to go through all of those rotations as well, and they're a lot of fun. Once you get through all of the basic training, you really want to get your hands on. So the second portion of the training, you're in those rotations along with full-time course load. So it's a lot, but at the end of your program, it's a great profession. And we do write a national board exam. So this allows us to be certified through the College of Physicians and Surgeons of Canada. And similar to a physician, we have to continue our mandatory continuing education CPD credits, which means as a professional, every year I have to do a certain number of readings or conferences, teaching to keep up to date with medical literature, just like my supervising surgeon. Where do PAs work in Canada? So currently, the PA profession is growing significantly within Canada. It's been established in the United States for a very long time. PAs are relatively new to Canada within the past few decades, and the profession started in our military and now has moved into civilian practice. So military PAs work across all provinces, territories in Canada, whereas currently civilian PAs in hospitals and clinic settings are mainly in Alberta, Manitoba, Ontario, New Brunswick, and Nova Scotia. We know that currently PEI, Newfoundland, and BC are all looking at expanding and bringing PAs into their provinces as well. So scope of practice, this is, scope of practice means what are we allowed to do as a healthcare provider? So physician assistants practice medicine within the scope of practice of our surgeon or our physician's scope of practice. This means if I work with an emergency physician, I will be practicing their scope of practice, the procedures, the interventions that they practice. If I work with an orthopedic surgeon, I will be practicing under his or her scope, which are different. I don't know if that's obvious, but they are doing very different things. There might be some overlap, but as the PA, as an extender of that professional, I can only practice under their scope. Although I can switch, just like I have in my own career, from one specialty to another, which is, it's interesting. PAs, some things we do, assist in surgery. So I'd be a first assist currently here in Halifax with a number of different types of surgery. We prescribe medications, we perform procedures that fall within our scope and training. And our practice mirrors that of our surgeon or physician again. And eventually, so generally within the first year of our practice on a specialty service, say I was working in general surgery, I graduate from University of Toronto or McMaster, I'm in my first year of practice in general surgery. That first year is a chance for the surgeon to train me in their protocols and their preferences. After that, you start working a little bit more autonomously. So as you gain a trust and a relationship with your supervisor, you start practicing a little bit more autonomously. So I'm not going to read all of these out loud, but these are just areas in medicine that PAs work. We do tend to focus on family medicine, emergency medicine, and a lot of the different surgical services, because this is where the need is, and primary care, as you know, in Canada and Nova Scotia, to have an extender help you with your patient load is a big help. And so, yeah, I'd say you can read through that list if you're interested. We can continue. So again, these are just some of the things that PAs can do. We can order laboratory and diagnostic imaging, interpret results, and then when we interpret those results, for example, and if I ordered an X-ray for someone in the emergency department, I would either make a diagnosis or I would create a differential diagnosis, which is just a collection of what the most likely diagnosis would be. And then we can treat patients in hospital, as outpatients, in clinic, and in the operating room. We assess our patients in pre-op settings and post-op settings. So this means if you came for surgery or if you needed surgery, I might see you before surgery in a clinic with my supervising surgeon, and then you'd have surgery, and then we would reassess you, how you're doing, how you're healing in the clinic afterwards. So PAs can do that. We share the load of the patient load with our supervising surgeon, and we consult and refer patients to specialties. So this could mean, for example, in my job, if I'm on the floor seeing patients who are admitted to hospital and I think someone's sick and I've ordered some laboratory tests, I might have to consult general surgery outside of my scope and ask for their help to come see the patient. And we also prescribe a set list of medications. I just included a few infographics about what we do, but this is just covering the same information. And these infographics are by a PA in Ontario named Anne Dang. If you're looking for more resources on the profession, she's got a great website linked there, and I've linked it at the end as well.
That's great. Thank you, Laurel.
Yeah. Things that we cannot do. So PAs cannot prescribe narcotic medications such as opioids. We cannot practice without patient consent, but that's pretty much all healthcare providers. And then we cannot complete any procedure order which is outside of our scope of practice of our supervising physician or surgeon. And why introduce PAs to Nova Scotia or provinces or the Maritimes? So this is really just covering basically the way that we help with efficiency in the medical setting. We help reduce wait times. So for example, in Toronto, when I worked in the emergency department, instead of a patient waiting 6 hours to be seen for a laceration, a cut, that I would see them within an hour. If my supervising physician was too busy with an acute patient in the trauma bay, I could see that patient, take care of them, suture them, set them up for care afterwards. And it really helps improve patient care and access to care. We help reduce physician burnout. So there have been some papers that look at the reduction in paperwork and time spent with patients. So you can imagine if I see on average 1/3 of our clinic, that helps free up some of the surgeon time for them to work on paperwork or something else. And overall, I won't go through all of this list, but we just help to extend our physicians and provide access to care. And this is another infographic, which we won't go through, but it's here if you would like. Again, this is by Anne Dang, which is on her website her blog, sorry. So specifically, this is just talking about my role on orthopedics, on the orthopedic surgery service. However, there are so many different services and areas of medicine that you can work. And as a PA, you're open to working in all of those. Again, I work in a fracture clinic and something called our orthopedic assessment clinic. So there are a lot of people within Nova Scotia who need hip replacements or knee replacements, and I help to see those patients in clinic. I also work with a trauma surgeon, and so I work in fracture clinic, which is seeing referrals from the emergency department or patients that we've operated on in an acute setting. And then we work in the operating room, and PACU is post-op care unit or post-anesthesia care unit. So that's working directly in the OR, assisting, opening, closing patients. We help anything the surgeon really needs hands-on, we help with. And then consulting. So that just means, again, I've covered that. If I needed to talk to someone outside of orthopedic surgery, I would consult a different service. Inpatient units. So we round on our patients in the morning, which just means we're checking on them, how they're doing the next morning after surgery, or if they're staying with us for a few weeks, we make sure that they're healing well and everything's going well with their care. Yeah, and basically our job in the pilot project right now is to integrate the PA profession into our orthopedic program, and we're hoping to expand again into other services in Nova Scotia. Those are just these are some of my interests. So it's just showing that although you can work in medicine, there's lots of other things to do. And I should say on the previous slide, I forgot to mention, we work directly with fellows, residents, nursing staff, allied health. So that's been a great experience, as well as a new provider to Nova Scotia. Everyone is very welcoming, and we work well with the nurse practitioners, our surgeons, and so forth. And then,
Oh, that's still on that one.
sorry.
Yeah, that's okay. Thanks, Laura.
And interested in knowing more. So again, if you want, I don't know if you want to write this down, or we can always provide you with this, but the Canadian PA blog by orthopedic surgery PA Ann Dang, she's got a wonderful blog out there, which goes through everything from what each program in Canada consists of. So what, for instance, University of Toronto has a lot of online education, and I know with the pandemic, things have transitioned more towards that. Whereas McMaster did a lot of problem-based learning. So just like their MD degree, McMaster is geared more towards problem-based learning. But her blog really outlines a lot of that. And then again, how to apply, how to make your application look great for the PA programs in Canada. And then Conference Board of Canada, the value and efficacy of PAs in Canada. These are 2 documents that were written based on data collected in Canada on PAs. And if you're interested in knowing more about PAs, those are great references. Finally, CAPA, that is our governing body. So the Canadian Association of Physician Assistants is our governing body across all provinces and territories. And they, again, they've got a great website, and yeah, that's it. So thank you for having me. And if you have any questions that I haven't covered, or if you want to discuss anything, please let me know.
That's super. Thank you, Laura. How exciting. Because I think you are so relevant to Anna, I'm going to let Anna lead off the questions.
Sure. Yeah, thank you. That's so awesome. I actually wrote down this PA blog and those things to look into, because I think it's really cool. You told us a lot about like why you chose the career and stuff and the education that you had and training experience. So I just want to ask, like, what do you love most about this job?
I was always a kinesthetic, hands-on learner. And that's why I did transition from biology, which is a great degree, but I learned more about human kinetics. And from there, the thing I love about my job is I get to be hands-on, and based on the curriculum and medicine, I really enjoy the hands-on component in working with patients, and every patient is a little bit different. So you meet a lot of people, but I just find medicine in general, the human body, very interesting. And as a PA, the exciting part is we do have the hands-on. There are obviously restrictions into how much, for instance, in the OR, we won't be doing anything of the super technical parts of the surgery, but we do still help with the surgery. We get to be completely part of that and immersed in that, and knowing so that would be my main. I love waking up every day and going to help patients, and also being part of the hands-on, with a team.
That's awesome.
Yeah.
That's awesome. It seems like, every part of the team is super important. And
every part of the team. Yeah. And again, that's another good point, working directly with all of the other healthcare providers. We're a team, so you get to learn about other people's professions at the same time. You have that social aspect at work, and there's always the other great part about being a PA, and it was something that drew me to this profession, is constant continuing education. So similar to a physician or surgeon, we are required to constantly learn about new technologies in medicine, new practice, new protocol. So it's fun because you never plateau. You're always learning something.
Thank you so much, Laura. We are out of time, but I'm going to give just a minute, less than a minute, if there's one question that pops up in the chat. But in the meantime, I do want to say thank you so much. This is so special to have you here, because it is so new and groundbreaking in Nova Scotia. It's very exciting, I think, for the healthcare profession. And again, I know you're in clinic today and you've taken time to be with us, so thank you so much. Anna, is there anything in the chat yet?
Nothing has come up in the chat yet.
Okay, if I get questions from teachers, Laurel, if you would consider taking a moment to answer those and get them back, that would be great.
Yep, absolutely. Thank you so much for having me.
Thank you. That was wonderful.
Thank you.
Bye.
Okay, everyone, thank you so much. We're going to move right along now. I'd like to introduce our second mentor. We're so pleased to have Carolyn McKinnon. Carolyn is a clinical pharmacist with the Nephrology and Hematology Department at the IWK Health Center. Welcome, Carolyn.
Hi, I'm happy to be here. This is fun.
Super great to see you. I just stole Anna's introduction again. Anna, do you want to ask the first question to Carolyn?
Sorry. Yeah, I'd be happy to. Just wondering, like, if you can just tell us a little bit about what your job is to start off with.
For sure. I know the job title can be very confusing. So, I am a pharmacist. So, you might first think of a pharmacist in like a Lawton's or a Shoppers. So, we would call that a community pharmacy job. So, I'm a pharmacist in a hospital. I'm here at the IWK, and I do have two specialties. So, that's the nephrology and hematology side. Hematology are your blood disorders. Nephrology are your kidney disorders, and I work with children. So, what I do is, again, people might be surprised to hear there are pharmacists in a hospital. So, when I first started here at the IWK, we did things similar to a community pharmacy. We have a dispensary where all the meds are, we get prescriptions, make sure they're appropriate for patients. And a lot of that has behind the scenes work of looking at lab work and dosing. We would the med to the floor. And again, our focus are the patients admitted to hospital, so just inpatient. We have a sterile room, so we have pharmacists that make meds that have to be prepared in a sterile environment. So that would be those special rooms with hoods and you're gowned up. We have chemotherapy rooms, so we have pharmacists making chemotherapy medications and looking at those orders. But then I had started there and worked my way up to a floor to have a specialty, like I mentioned. So, what I do is I'm up on a floor that if any patient is admitted for either a blood disorder or kidney disorder, I would work with that team. Something really fun about the nephrology side of things, the kidney disorders, are we are the pediatric center for Atlantic Canada. So we have quite a few patients from Newfoundland, New Brunswick, and PEI. So not only Nova Scotia. So they would literally fly here for their admissions. Sometimes they're life flighted here depending on their situation. So yeah, what would I do on a floor? At first, I get to meet the family, meet the patient. I get to have a background info of what meds they're taking. And then I actually get to work very closely with the team, and the team being not just the doctor, but the nurses, the social work, the dietitian, who's very important, physio, occupational health, you name it. We're a huge team. And every day we have rounds. So we would meet for an hour or how long it takes to go through every patient, head to toe. And then I help out with dosing. What meds do they need right now while they're here in hospital? It could be an antibiotic if they have an infection. There's particular meds that they have in nephrology, and they have to be dosed a certain way. Because a fun fact, a lot of medications need your kidney to work to get it to work and to excrete it. So, got to play with that. So, in a typical day, I get to meet the family, do a med history. Then I work with the team all day long, look at the lab work, what's appropriate, what do they need, all the way up to they get better, ready to go home. I help with their prescriptions and drug coverage. So a patient goes home, maybe they can't afford it. So before we get to that point, we see if we can fill out some special paperwork or change the medication and make sure that they can go home and get the meds in their hands. And I do a lot of counseling with the families. So I teach them, what is this med? What does it do? How do you give it? What's special about children? Well, I can say special. Not a lot of 5-year-olds can swallow pills. So we do a lot of compounding at the IWK. So that would be making pills into liquids, into suspensions. So I teach the families how to measure a dose, how to give it, what to look for to make sure it's working, if it's not working, and all that stuff. And like I said, nephrology, for example, we're the pediatric center for Atlantic Canada. So that means that if a patient is diagnosed with a kidney disorder young in life, we will see them probably up to they're 18 years old. So we get to make really close connections with these families. So even if they're from Newfoundland, they fly here, we see them once a year if they're doing well. Throughout the year, they're calling us to check up on prescriptions. I get to see how they're doing, and you really get to make those connections. And I really like that long-term follow-up.
That's a
That was
great
a very long
overview.
answer. Sorry.
No, that's a great
Oh,
overview.
that's wonderful. Like you're involved every step of the way.
Yeah,
That's really
it's
awesome to hear.
surprising. Yeah.
Yeah. Um, yeah, so you told us a lot about like what you actually do, but I kind of want to know what education you need for this role or what education and training, like how you got here.
Yeah, of course. So to be a pharmacist, you do need to go to through a pharmacy program. There are 10 schools across Canada that have pharmacy programs, BC, Alberta, Saskatchewan, Ontario, Quebec. Then there's 2 in Atlantic Canada, Memorial in Newfoundland, and Dalhousie here in Halifax. So I went to Dalhousie. To get into one of the programs, you do have to complete prerequisites. So those are certain courses you need to have taken. And now it'll probably take a minimum of 2 years to have all those courses under your belt. And they're a mix of, chemistry, biology, anatomy, biochem, but then there's even English and math in there. So I personally did a 4-year undergrad degree at Mount Allison, and I did a major in chemistry with a minor in French, just to keep it interesting, because I didn't know if pharmacy was right for me until my 2nd year, and I was talking to a friend who was a pharmacist, and I love the idea of healthcare, of helping people, and I didn't know that pharmacists had so many different roles. I thought, just you work at a community pharmacy, but then I learned about hospital and getting to work right with the doctors and nurses and making a difference. So I decided to complete my undergrad, did my 4 years, apply to pharmacy. There is an interview process. So yes, you have to complete all your prerequisites. But then we have we call it MMI interviews, multi-mini interviews. So that's when you have little situations in different rooms. So that's the interview process, and it's a 4-year program. All the pharmacy schools in Canada in the last 2 years have transferred to a entry-level doctorate of pharmacy. So what that means is I have a Bachelor of Science in Pharmacy, but this entry level, which is what you would get in any pharmacy school now, now it's 2 years prerequisites. In my time, it was just 1. And you have more clinical time. So in that 4 years at pharmacy school, you have placements in hospitals and community pharmacies to get more on-the-job experience. So, 12 weeks in your 3rd year and 4 weeks in your 1st year. So it builds up as you go. And then for me, because I liked hospital, there's another level of education you can do. It's optional. It's getting quite competitive now. It's called a pharmacy residency. So you do your 4 years at a pharmacy school, and you can apply for residency. There are 100 spots in all of Canada. You apply for it, again, an interview process, and it's a whole year in a hospital doing different rotations in different units, just on-the-job training. And at this point, you are a registered pharmacist, so you kind of have more liberty there, but you're learning a lot fast. And then having that under my belt, I applied to IWK. And I did forget to mention, after your 4 years in pharmacy school, there's a national exam. So we call it the PEBCs. It's hosted by the Pharmacy Education Board of Canada. So every single pharmacy student in Canada has to take the exact same exam at the end of your 4 years. It's 2 parts. It's written and practical. So you do have an in-person, you're with a doctor, you're with a patient just to practice your counseling skills. And you have to pass that national exam to then apply for a license. And each province has different rules of licensing.
Very cool. Awesome. It's a lot of school, a lot of qualifications. Yeah.
Yeah.
Um, so you talked about a lot about what you like about this job, what you did to get there. Now I'm and a little bit about your typical like work day. I'm wondering, can you talk a little bit about the pay scale for this job?
Sure.
Yeah.
So I can only speak to the hospital side of things
Okay.
because when you're in community, there's also different levels if you want to become a manager or an owner of a pharmacy. But in hospital, I think you start around 35, 38 an hour, and it can go up to 40, 45 an hour, depending on your level of expertise and if you do start to specialize. So that's rewarding. Yeah.
That's great.
Awesome. Thank you.
Thank you, Carolyn. I have a question about, you talked a lot, or I got a sense about what you really enjoy about your job, those
Yeah.
relationships and the teamwork and developing those long-term support services for your patients. Can you talk about the most challenging parts of your job?
A challenging part would be the unpredictability. So we do have those patients we follow, for their whole childhood that maybe we have a regular scheduled meeting once a year for them to come in and do a head to toe. But it's, you're working in a hospital, you never know when a patient's going to be ill and when they come in, how complex they're going to be. But it's also an exciting part because, you have new challenges every day. And you mentioned I love just being able to work with a huge team. I mean, I have the doctor right there that I can tap on his shoulder saying, hey, can you do this? So that part I do love. And yeah, the teamwork is great and meeting families, but the unpredictability and on the pharmacy side of things, drug coverage can be very tricky. Yeah.
That's great. Okay, thank you, Carolyn. I'm going to put it out to the teachers and students to see what questions they have for you, but I'm going to give it back to Anna for another question.
Yeah.
Sure.
Yeah, I was wondering if you could talk a little bit about work-life balance.
Sure, very important.
Mhm.
I do like to think we're some of the lucky ones being in hospital. We do have to do some shift work. So typically you do have a Monday to Friday 8 to 4 job, which is kind of the dream. But every 3 to 4 months, you do have to work so many night shifts and weekend shifts and on-call shifts. Night shifts are only 1 to 9 p.m. So I work like one night every 3 to 4 weeks. Weekend shifts are Saturday, Sunday, 8 to 4, but then you do get days off if you do that. And on call is something unique, I guess, to a hospital. In the middle of the night, if a patient needs a medication or a doctor has a question, there's one pharmacist assigned every night to take a computer and a phone home that can ring 3 a.m. You never know, to be able to answer their questions. So I do an on call shift every 3 to 4 weeks as well. So it's nice to have the shift work. If you work a night shift, you get the morning off to do other things. You work a weekend, you get a weekday off. So you do some of that, but I mean, Monday to Friday, 8 to 4 is very reasonable. It's great. And I was going to mention continuing education. So I know you got to see that in Laurel's presentation. Us as well, we are, for a license, you have to have 15 points every year for continuing education, CEs. So our job's always evolving. I mean, now we give injections. So you can get your flu shot at Lawton's. We also did COVID vaccines here at the hospital. I got to inject. We get to prescribe now. So to do all that, you have to learn it. So you can do it in your spare time, but a good balance here at work is they'll give you protected project time or learning time that we can have an afternoon to look up new therapies, do some virtual courses. Yeah.
That's awesome. It's great that they're really encouraging that through allowing you that time.
Mm-hmm. Oh, yeah.
We do have a couple questions in the chat. I will read.
Great.
Adam Boonin put in, does the pharmacy program include a number of chemistry-related courses?
Pretty much just prerequisites. I think in my first year I took biochemistry, but now I think that's shifted to be a prerequisite before you apply. So we did have a biochem lab, and we took a lot of organic chemistry as well. But again, I think that shifted to be a prerequisite. So I don't know if that's part of the curriculum now. I know every school, and Dalhousie being the one I'm familiar with, they have it all listed on their website. So I'm almost positive that's changed to a prerequisite. So you would do that in your undergrad.
Okay, cool. Thank you. And thank you for the question. I have another question here from Lynn Little. Are there many jobs like this in Nova Scotia?
Oh, great question. So even in the rural hospitals, there might be only like 1 or 2 pharmacists. Here we have about 20 or 30 pharmacists. So the demand, it is tough to get in because there's not always jobs opening, but we do have people that go on leave or mat leave. So we're always looking for people to come in even for a year or two. Once you get your foot in the door, you're there. So I would say every hospital has access to a pharmacy. Here in Halifax, we're lucky because we have big teams. The adult hospital, which we work really closely with, they have quite a huge team between the QE2 and Victoria General. And, up in Cape Breton, their hospital pharmacists. So yeah, almost every hospital has access to a pharmacist.
Great. Thank
That's
you.
great. Thank you, Carolyn. Thank you so much for being here this morning.
My pleasure.
I know that for all people in healthcare, especially when you're working in a hospital, it does take some coordination with your team to be able to be here with us. So on behalf of JA Nova Scotia, thank you to you and your team for volunteering your time this morning. And take care and all the best for you.
Thank you. And if there's any questions afterwards, I'm happy to give my email, reach out. If anyone's interested in pharmacy, just send an email. I'm so happy to talk more about it.
That's super. Thank you so much.
Right. Thank you so much.
Welcome back, everyone. I hope everyone had an opportunity to take a little stretch break there. We are happy to welcome our next career mentor. I'd like to introduce Autumn Grant. Autumn is co-founder of Flow Meditation and Wellness. And Autumn, I did mute you there during the break so you could have some privacy. So you'll have to unmute yourself there. There you go.
Hello, good morning, everyone. Thank you so much for having me. My name is Autumn Grant. I am the co-founder of Flow Meditation and Wellness. And I'm just going to share my screen here for a moment. Let's see. Oh, I don't believe I can share my screen, actually.
Do you want to give it another try?
Sure.
We have lots of time. No hurry.
All right, is that...
It's coming through. Yeah.
Okay, fantastic.
Perfect.
So thank you so much for JA Nova Scotia for having me. First, I would like to acknowledge that I humbly work and live on Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. We are all treaty people. And I invite you to take a moment to pause and reflect, because in the Mi'kmaq language, Dalasi means welcome, but it technically means come and find your place. And I think that is so relevant for our topic today. So just maybe taking a moment to think about what that might mean for you. Okay. So I am the co-founder of Flow Meditation and Wellness, along with my partner, Jonathan Doroja. We established in 2018 with a mission to build a happier, healthier, and more connected society through mindfulness and meditation. So we consider ourselves the co-founders of Flow Meditation, but we're also a family-run business. So we're parents of 2 young girls. We have Florence, who you might be able to make the connection with, Flow Meditation in Florence. And then we have an 8-month-old daughter named Iris as well. And we also consider ourselves community connectors. So we're really on a mission to make mindfulness accessible to everyone. So I'd love to tell you a little bit about my path and how I came to be an entrepreneur in meditation. And I'll take you back to my high school days. I graduated from Halifax West High School in 2008. And in high school, I wasn't always the strongest in math or the sciences, but I was really into sports. I loved fashion. I worked in retail, and I always only considered what professions I really knew were available. You know, I considered a path of becoming a teacher, of becoming a nurse, and I, did my prerequisites in high school to set myself up for success in a way that would leave some options open. But nothing was really, forming for me at that time when I was about to graduate high school. And so I decided to take a gap year because I had this itch to explore the world beyond the classroom. And so I moved to Florence, Italy to become an au pair. So I moved in with an Italian family, and I took care of their 2 young children. And that gap year was the most incredible and most influential year of my life. So I had an opportunity to explore a new culture and learn a new language. I took courses in fashion, and I realized that, there's so much more to the world, and I was inspired. And the family I lived with, they actually had a non-governmental organization in Ethiopia where they helped street children. They brought them into the center where they taught them sustainable life skills so that they could go on and have these technical skills that would help them thrive in sort of Ethiopia. And I remember just being so intrigued and amazed with, the global issues that had come up through this NGO that they would share with me. And it really got me thinking, which actually inspired my university degree. So after a year in Italy, I came back. I often had people say, "Oh my gosh, you're going to live in Italy. You're never going to come back. You're never going to go back to school after taking a gap year." But I was really inspired to do so, and I ended up studying international development studies, and I have a combined honors with environment, sustainability, and society as well. And I did my degree in 4 years, but it wasn't always. I didn't always know that I was going to study IDS and sustainability. It was more of a trial and error, and I really chose courses that were of interest to me. And that really helped me in a lot of ways. So after my university degree, I spent 2 more years traveling around the world. I'd work a little bit, and then I'd take off on a backpacking trip through Southeast Asia or to Africa and Europe and the Caribbean. And I always found that the traveling and meeting new people and experiencing other cultures had impacted me in the most profound ways. And so after a couple of years of traveling, I decided that after a Bachelor of Arts degree, I did want to get some more technical education. So that's when I moved to Vancouver, British Columbia, to study human resources management at Simon Fraser. So I have a continuing study certificate from SFU as well. And then while I was working and studying, I was recruited as the people and culture manager at the Lululemon Lab in Gastown in Vancouver. And this was the most amazing job that I had to date. It opened my eyes and helped me create visions and goals. And as a part of our schedule at Lululemon, we were required to go as a team to a small meditation studio that taught us mindfulness and meditation. And so this is where I was introduced to the practice of mindfulness. And, I have always been a person who has been always go, 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 had super busy and full life. And this opportunity to really slow down and reflect completely changed my life. And so in December of 2017, I had a baby with my partner, Jonathan. And shortly after, we moved back from Vancouver to Halifax. And while I was on my maternity leave, we were truly inspired by Halifax and the opportunity for entrepreneurs. And we decided to open our own mindfulness and meditation business. And we had a little studio on Argyle Street in downtown Halifax, where we would host events and meditation classes. And then the pandemic hit. So we ended up closing our physical studio as we realized that it was more powerful to bring meditation to others. So that's when we started hosting pop-up meditation classes at different fitness studios around the city. We would collaborate with other businesses and host workshops and retreats. And then we got into a lot of virtual stuff. So we built corporate wellness programming with different facilitators in Nova Scotia. We also have been doing a little bit of merchandise. We create meditation cushions that are locally made. And we also have been hired as like a third party to write and record meditations for apps and businesses. So Jonathan and I are the head of mindfulness for the Focus Factor app, which is a brain health supplement company. And we also offer courses in breathwork and mindfulness meditation for those who might want to learn how to teach meditation. And so that brings me to your path and a little bit of advice that I might have for you. So I feel that the most powerful thing in my life was slowing down and not rushing. I feel as, maybe a junior high or a high school student, it's really hard to know all of your options that are out there. So I feel like junior achievement is such a beautiful way to understand and give you access to all the options that are. But honestly, I never knew exactly what I wanted to do. I didn't know that I wanted to be an entrepreneur, but what I did do was I gave myself the space in between high school and university, and in between university and my continuing studies and different jobs, to slow down and really, take time to connect with my true authentic self and see what lit me up, and followed what I was good at. So at times things didn't always make sense. I felt like at times it said, okay, like why am I taking this course? Like, how does it align with my future goals? And sometimes you don't know, but it all comes together in the most amazing ways. So what I would do for yourself is consider what you are good at and what lights you up. What are you interested in? And follow that. Know that you are in a place of choice. There are so many options out there for you. And I really advise you to take comfort in knowing that you can say no to things that don't necessarily feel good for you, and know that when you do say yes, there's a world of opportunity out there for you. And my advice would be to slow down, and you'll get there faster.
That's great, Autumn. Can I ask a question before you go on, just to jump in there for a second? And I know, so, we've had some, more traditional healthcare model careers prior to you. So a physician assistant, because the world is ever changing, and a clinical pharmacist. And then to look at meditation and mindfulness and just the well-being that you are sharing through your centers, or the the practices that you're holding. Where do you see flow meditation and wellness fitting into as an alternative, if I can call it that, healthcare career?
Absolutely. That's a great question. And I think that more than ever, we need mental health resources, and mental health resources in terms of preventative or for healing stress and anxiety through the times that we're living in. So I think this is a huge alternative, because it's become more of a lifestyle. And I feel like with the modern medical paradigm, we might not always have these resources that we have internally. We might not know what they are. So by teaching mindfulness and meditation, we're essentially learning how to become masters of our own nervous system and come back to ourselves. So I think that is how it is an alternative.
That's great. Anna, do you have a question for Autumn?
Yeah, I was just wondering if you could talk a little bit about your work-life balance. Like you said, you started this kind of entrepreneurship, but I'm just wondering how like your day-to-day looks like.
That's a great question, Anna. Thank you. I think my partner and I always laugh because we literally like our lifestyle is mindfulness and meditation, and we really try to incorporate that into our life. So, you know, we eat, breathe, sleep meditation and mindfulness, and we're always trying to practice what we're teaching. And so, in terms of work-life balance, it's a good question because it's really we live it, and there isn't a whole lot of separation, but we really enjoy it because it is such a wonderful practice. But that said, I love being an entrepreneur, especially with two young girls, because I do have the ability to make my own hours and choose what I can take on and what I want to take on. So, you know, I can choose the time of day that I want to teach a class or take on a meeting or do a one-on-one, and so that's how it is for us. There is a great work-life balance, but we do live it.
That's great. Thank you.
Thank you.
And Autumn, I don't know if you have more slides to share, but I have another question for students or teachers who haven't experienced meditation or mindfulness, and I have been in a session of yours before. Can you speak a little bit about how you bring people there?
Totally. So, do you mean in terms of like physicality or like physically there or mentally?
Maybe a little bit about, just so they have an idea of what it is you actually do. So when you're teaching, what do you do?
Right. So mindfulness is a quality. So it's essentially just being present in the moment. It can be done anywhere at any time, as long as you are in the moment. Whereas meditation is more of the formal practice of sitting down, as I am pictured here, in more of a traditional pose with legs crossed. You have a straight spine. You're welcome to close your eyes and you tune inward. So it begins with the basis of finding your breath and using an object of focus to help you tune into the present moment. So in terms of space, you know, we'll teach classes at a fitness studio on Quimble Road, for example, and we bring everyone in and we create an ambiance where we have dim lights, we have nice calming music, and I guide you through a meditation, which can be in the form of a body scan where I'll have you tune into different points of your body. I'll allow you to I'll say mantras that might connect with you. I'll typically write a script beforehand if I have a topic or a theme that I want to focus on, such as, you know, a meditation for reducing exam stress, or a meditation for sleep, or a meditation to enhance joy in the present moment. So there's a world of opportunity for even just topics in meditation. And I'll invite people to lie down and have a nice relaxing experience, or, you know, sit up if you want to really enhance your ability to focus. It just has so many wonderful benefits. And it just has the most wonderful way of calming your body and mind at the same time.
Which is so important, as we all know. And I'm sure as you worked through COVID, though it was challenging for you as an entrepreneur, I'm sure that the benefit people could recognize very well the benefit of what the service you're providing to them, with the stresses that we're experiencing through all of that as well.
Absolutely. And I think that with the pandemic, there's been even more opportunity because more and more people are looking for this type of practice to heal.
Great. Anna, do you want to manage the chat?
Yeah, so we did have a question from Abigail Fraser. Thank you for your question. It's, what would be the pay scale for this job or something similar?
That's a great question. And we have different revenue streams for this job. So, if I were to teach a class at a fitness studio, I would probably get around between $40 and $50 for a 45 to an hour class. But then there's bigger opportunities through like corporate. So if I do a corporate webinar, I could charge up to like between $400 and $500 for a session. And then I also speak at conferences as well. And, conference speaking, I earn sometimes between $1,000 and $2,000 per session. So I just wanted to touch on, there's different ways that we've built the business to be inclusive and accessible. So sometimes we'll do free things just to build community, because that's really important to us.
Great, thank you. I also have a question from me. I'm wondering what kind of, if somebody wanted to become a meditation teacher, what kind of training or experience you would recommend or that they should do?
Totally. The first thing would be to start consistent practice yourself. That's been the most powerful. I did my meditation teacher training through the Lab of Meditation with my teacher, Hiroko Demichelis. And it's called the Lab of Meditation. And then we actually offer smaller courses, a 30-hour course in breathwork, mindfulness, and meditation as well. The course that I did was accredited with the International Mindfulness Teachers Association. So, maybe a degree in psychology, if you want to become a psychologist or a counselor, then that would be a really nice way to get into it as well.
Awesome. Thank you.
You're welcome.
That's super, Autumn. And I cut you off in your slides, and I apologize, but I was really excited to just dive into because I think some students might be like, but we're very familiar with the very traditional healthcare sort of streams, nursing and physiotherapy and whatnot. But I think the world is changing, and these alternative methods of, like you said, preventative healthcare supports are so important, and they're becoming more and more relevant and prevalent. So is there anything else that you want to share before you leave us today?
I think that, I would just truly follow your heart. And I used to get so caught up in what my friends were doing and I wasn't necessarily good at those things. And I was always curious beyond school, and that kind of looped around and brought everything back together. My passion for people, the planet, and bringing it all together through mindfulness and building community is what is so important to me. So it doesn't always make sense, but if you follow your heart, then you'll find your place.
That's super. Thank you so much, Autumn. Thank you for being here today. Take care, and all the best to you and Jonathan.
Great. Thank you so much for having me, and good luck.
Okay,
Thank
bye-bye.
you. Okay.
Okay, welcome back, everyone. Anna, I will give the introduction for our final mentor over to you.
Okay, so our final mentor is Kelly Carrington, owner and RMT at Mandula Birth Services and Evolution Massage.
Morning, everybody.
Welcome, Kelly. Thanks for being here.
No problem.
Can you tell us a little bit about what it is you do? What is a mandula?
Well, I'm a certified birth doula, and there's actually no word for a male in the role. So people started calling me the mandula, so that's just what I am. So a birth doula provides education, physical and emotional support, and postpartum care, which is the care after baby's born, to families. And that's pretty much it in a nutshell.
That's interesting. And what is RMT massage?
Oh, yeah. So I'm a registered massage therapist, and I've been that for 20 years now. So I do massage 6 days a week, that's what I do on a regular.
And I think there's going to be students and teachers out there that are very interested in both of those. But I think people are probably a little more familiar with the role and what a massage therapist does. Can you dive into the doula side and really tell the students what that looks like? Like, what does a day look like for you?
Yeah, so it really is quite varied. But the reality is that when a family hires me, we go through prenatal education, which is essentially me teaching them all the things about the physiological part of growing a baby, birthing a baby, and what to do with the baby afterwards. And then I do that all beforehand. And then I actually go to the birth to help support them physically and emotionally. And then afterwards, I help them with all of the aftercare stuff for mom, baby, family. And it's just a lot of education and a lot of physical and emotional support. So really just talking to people.
That's super. And can you talk a little bit to students about what, I guess, what the role is within Nova Scotia healthcare specifically for doula? Where do they fit with the traditional, birth practice?
Right. So it is sort of outside of the clinical because doulas are not clinical practitioners. So if a family has a midwife or a OBGYN, they may decide that they want more personal support and then they will hire a doula privately. So it's not covered under most healthcare plans. It's not covered by MSI. It's sort of outside and it's done privately. But doulas work well with midwives and the regular hospital system because we have to usually go into their hospital to help. And so we work sort of alongside, and we're really an adjunctive part of the practice for the whole family.
Super. Anna, what questions do you have for Kelly?
Yeah, I'm just wondering like why you chose this career or what led you to doing this.
Well, I've been a massage therapist for a really, really long time, and I would see a lot of pregnant women who'd be having babies, and I treat them as a massage therapist. And then some of my friends and colleagues had suggested that I get into doing the birth work just because of the way of my approach. And I looked into it, and at the time I was like, I don't have time. I have 3 children, and I'm married, and I have a very busy life. But then I thought, maybe this is a way for me to connect the two parts of my job. And then I looked into it and I did the training, and it's been going ever since pretty much.
Wow. I'm wondering what does the training look like that you have to do?
So the training for a doula is mostly self-directed. So
Okay.
there's certain organizations here in Canada that will give you like a certification package that you have to complete. You have to do multiple courses on birth, breastfeeding, baby care, all those types of things. And then you do a lot of reading, and you have to write some papers, and then you have to put it all together. You have to go to births and document everything. And then you put it all together, you send it to the organization. And as long as you've done everything that you've been asked, then they will certify you.
Wow.
Okay, thank
Very
you.
cool.
And in speaking the same way, Kelly, can you describe how you got into massage therapy? So the very start and what the education was that you needed for that.
Yeah, so I graduated high school, and I wasn't really sure what I was going to do. And so I went to work, and then I realized very quickly that I needed more education. And I looked into massage therapy, and I thought, that would be a good idea. And I went to school. It's a 2-year program here in Halifax, anyway. And it's a 2 years full time, and it's a lot of science and a lot of reading and a lot of memorizing. And you do that 2-year course, and then you have to go find a job. And so I worked for somebody else for 6 years, sort of getting used to being a practicing massage therapist. And then I decided once we started having children that I wasn't getting enough time at home. And so then I started my own company, and I provide mobile massage. So I go to people's houses and go to businesses, and that's how I practice now and have been for a while.
Very cool. What is the school that you go to for massage training in Nova Scotia?
There's 4 schools here in Nova Scotia. I went to Northumberland College,
Okay.
and it's a 2-year diploma program. Most of them are about that same. So, you can just Google it, Massage Therapy School in Nova Scotia, and they'll all come up. Some of them are administered by community colleges and private colleges. Northumberland College is a private college.
I've actually gone to the Northumberland College for to have the students practice.
Yep. Oh, yeah.
Yeah.
22 years ago, I would have been one of those students.
Yeah. Very cool.
That's great, Kelly. I have to dive in. So in Nova Scotia, you say you're called the man doula. Is it unusual to see a male in the role of a doula? And can you talk a little bit about maybe the strengths or some of the challenges that you've had in that role?
I think it is a little bit unique only because most people, this is not what they picture as a doula. And you know, like when I did my certification, I really didn't know that there was not that many men. And I didn't really care because this is what I wanted to do, and I didn't care what anybody had to say about it. So I just did it. In terms of challenges, I don't really face any challenges. I mean, there's like this many people that want a doula, and then there's like this many people that would like me, right? So I just do my thing, and if people appreciate it, people will hire me. I don't really, if I was concerned about what other people said about what my career choice was, then I wouldn't be where I am today. And so if it's something that you're passionate about, you just have to do it. Like nobody can tell you what you're passionate about. If you're passionate about it, you just have to do it. So I found what I'm passionate about, and I just went out and I did it, and I've not had any adverse reactions to it or anything.
That's super. Great advice for the students, for sure. Anna, I'll give you the next question.
Yeah, I'm just wondering, like, what do you enjoy most about your job?
Just dealing with people, right? Because all of my work, even if it's massage or the doula work, is just dealing with people. And I really enjoy the fact that it's different every day. So whether it's a massage client or I'm going to a birth, it's never the same. And so I don't get bored, and there's always new challenges that you have to figure out and new things you have to overcome. But I have the years of experience behind me to know that I can overcome those. And it's just every single day is just a new challenge, and it's really exciting because I don't know what my day is going to look like.
Mhm.
Like I'm on call for a baby right now. I don't know when it's going to happen. I have my set massage schedule, so I know what I'm doing for massage, but then I don't know. Maybe I'm going to go help someone have a baby. I don't know. So it's that. And also the flexibility of my job, because I do have 3 children and I'm very involved in my home life, and it's very important to me. And being self-employed allows me to do that.
Yeah,
That's
very
great.
good. Yeah. I was also wondering, like, how do you deal with that unpredictability on the day to day? You said you enjoy that part, that it keeps it exciting, but how do you prepare yourself for that?
Well, I mean, there's nothing I could do about it. So I make sure, like, my massage I'm always booked about 6 weeks in advance. So I know what that's going to be like.
Mhm.
When I'm on call for a baby, my clients get a notice that I text or email to them saying I'm on call, so I may not be able to show up. If I can, I'll let you know. It's just, I have a huge amount of support from my family that I can just drop everything and go, whether that's 2 o'clock in the morning or 2 o'clock in the afternoon. And you just kind of have to roll with the punches. Like you don't really know what's going to happen on a daily, but I'm prepared for all of it. So I make sure that I exercise on the regular. I make sure that I eat well all the time. I make sure I try to get as much sleep as I can, which is not very much, but you know, I try to make sure that things are relatively stable so that I can just do my thing.
That's awesome, and that says a lot about, like, your healthy work-life balance that you have.
Yeah, and I'm working on getting more balance, because people talk about work-life balance, but if you're self-employed, if you don't work, you don't make money.
Yeah.
So some people fall into the trap of, I have to work all the time so that I have money, but money is not the answer all the time. Money allows you to have function, but if you want to have joy, you have to have a balance of both. And I'm working now on trying to find a little bit more balance. I have a lot of balance right now, but I want more because I want to be home more. But this has taken me 20 years to get to build my practice so that I can make that flexibility happen. So yeah, in the beginning, you just got to work, but then you can carve it out, like slowly carve out the time, because I'm a massage therapist and a doula, but that's like a small portion of who I am. That's just what I do for work, right? There's other things in my life that I want to do more of, and I've gotten to the place where I try to make that happen.
That's awesome. We do have some questions coming through the chat for you. So Lynn Little is asking, is there much job opportunity in Nova Scotia for massage therapy?
Yeah, I mean, you talk to any massage therapist and they're busy, 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 busy. That's because the demand is high. So if the demand is high, we need more massage therapists to be working because it's only going to get more. And that's just the reality, because more people, especially with this pandemic, are more interested in self-care. If anything has come out of the pandemic, it's just been that people's realization of making sure that they take really good care of themselves has come to a higher level. So people want to do that. So the demand is probably only going to grow.
Yeah, I believe that. Thank you for the question. Thanks for answering. There's another one we have in the chat here from Abigail Frazier. She's wondering, what is this pay scale or scale of pay for a doula and also a scale of pay for RMT?
Well, it depends. Like if you're a massage therapist for one, sometimes you work for somebody else and you may make $20 an hour, or you may get a certain percentage of each massage. If you are self-employed, you can kind of set your own rate. My rate is a little bit higher than the average because I do run a mobile company. So I go to people's houses, I go to businesses. So the expenses are a little bit higher. And the specific, like right now, it's $125 an hour is what I charge. Now that sounds like a lot of money per hour, but it's actually not, because you have to pay your taxes. I have to pay for fuel. I have to pay for my car payment, laundry, all those things. So I still make a very good living, even though it sounds like I make a lot. There's a lot of expenses associated with running a business. In terms of doula, I think it ranges anywhere from $800 to $1,500 per birth. But when I break it down, we end up being less than minimum wage, because you don't know how many hours you're going to be at the birth and things like that. So when I charge a family my amount, it's really just to cover the cost of me not working for doing massage and cover the expenses associated with me being out of the house for a specific amount of time. But you can make a living.
Very interesting. Thank you. And thanks for the question.
Yeah, I've a question as well. I'll just jump right in as we wait to see if there's more from teachers and students. So Kelly, to me, it sounds very exciting, and just the ability to be there as someone's having a baby, and that's part of your normal every day. Can you talk a little bit about, and people's emotions are running high, and just about that experience, and maybe the type of person who would be good at that, or what are some of the qualities or skills that you have that enable you to, calm a person in that most hectic moment of their life?
Yep. And I mean, the thing is that sometimes, like, people usually hire me because I'm pretty steady. Like, I don't get too revved up about much. My family may disagree, but I'm pretty steady. And I am there to make sure that the mood in that birth room stays calm, because you can't make big decisions under duress. And it's just my approach. Like, the birth is a physiological process that's going to happen. It's our approach that it will affect the outcome. And so I just am calm. I mean, I'm really paid to stay up and show up, and that's what I do every day. And it's just about, if you're ever in a situation where everybody around you seems to be freaking out, but you're not freaking out, well, then this might be something, because if you can stay calm and when everybody else is freaking out, then this might be the place for you.
That's great advice. That's a good point. Kelly, thank you so much. Is there anything we didn't touch on that you think would be important for the students to know from your experience, both your education, personal and work experience, as we wait to see if there's any other questions to follow?
I think the biggest thing is really, like, if you have an idea in your head of something that you want to do, but people around you are saying, you can't do that, or you shouldn't do that, this is not the place for you, but that is what you want to do, then do it. Like, you can't, like, I think I said this before, but you can't let anybody else dictate what your passion is. And life is pretty short, and there's no point in doing something that you don't want to do. And so if there's something that you're passionate about, you got to make sure that you do everything to make that happen. That's the big thing. Because if I listened to people, I would not be doing what I'm doing right now. Right? But if you really want something, you just have to get it.
Super advice. and we're going to take that and we're going to leave with that. Thank you so much, Kelly. I'm really glad that the baby's coming, but didn't come while we were on the call.
Yeah, me too.
Yeah. And if we have more questions, I hope that you'll consider maybe if I could forward those to you and get back if there's any students with particular interest in either of those, if you had some mentor advice for them.
Absolutely. You know how to get a hold of me.
Okay. Thank you and good luck. Best of luck to everybody.
Okay. Thank you.
Thank
Have a
you.
great day.
You too.